We're going to talk about the first chapter now, and it starts with a statement, and it's really setting the scene for it. It starts that the paper is part of the big society, and the NHS, the work of the NHS is based on need, and the government are committed to increasing the expenditure in real terms. But this white paper is written in an area of austerity. So in real terms, it doesn't mean much more money, but it does mean that the cuts won't be as great as in other public sector areas. It promotes equality, and it gives a role for the new NHS commissioning board. It is also committed to the NHS constitution, and there's a clear direction in the whole paper of devolution of power from the Secretary of State to much more frontline services and NHS institutions. The NHS today is some areas are world class. It acknowledges that, but some areas it feels there needs to be a much more emphasis on quality. And compared to other countries, health outcomes are not so good. So there's a much bigger emphasis on public health and the role that the NHS has traditionally had in preventative medicine. And the white paper really tackles the fact that it doesn't feel that the NHS has been particularly patient-centred. It's rather been driven by the services around the patient. So the patient hasn't been in the heart of the services at all. It's been driven by the services that have been developed around them. And there's a statement in there that says that the new headquarters are not the Department of Health, but they're or the new commissioning board. So the power is going to the frontline clinicians and the patients. The current architecture of healthcare has been developed in piecemeal, and they're radically going to simplify the system. So they're going to reduce the levels of management. GP consortium will emerge from what has been practice-based commissioning, and Monitor will be the economic regulator for all of the service. Improving public health and reforming social care and the Department of Health will be a core to that strategic direction, with a focus on reforming adult social care and public health. Public responsibilities for public health will transfer to the local authorities and will have a ring-fenced budget. They've always had a budget, but it's never been ring-fenced in the way that it's going to be now. And the allocation will be have a new health premium, and certainly disadvantaged areas may well see the benefits of that. Adult social care is also a very important area. So there should be a more seamless service between the services offered in the NHS and those offered in the local authority. And again, there will be much more emphasis on prevention of healthcare rather than the incidence of emergency care that are felt to be too regular at the moment. So there'll be much more on long-term conditions and how you prevent people becoming ill or going into the acute. There is an acknowledgement that this is being done in an era of economic austerity, and of course they're expecting more to be done with less money and with less managers around, but it's much more a redirection of funding to frontline staff and taking away the layers of management, but actually looking at preserving the frontline staff so that patients get the care that they need. But there is a big emphasis on spending efficiency, and they're very clear that there will be no bailouts for any organisations that overspend. In conclusion, there are a few sort of key sentences that they're making change for the long term. They're very clear that they won't publish another long-term plan, and they're moving towards much more transparency of what is being provided. And it's not that it's not going to be the government that dictate it, but it's going to be the GP practices. What I want you to think about, and we've put the questions up already, is in your working lives, can you recall instances where the system fails the patient and where the patient-centred care hasn't worked? And how could these reforms improve that? What does it mean for your working life when throughout the chapter it describes about outcomes and prevention rather than just targets? And so I think there's a few questions there. Does this mean less targets? And because we're now dealing with outcomes, or do you think we're still going to get the targets, but we're still looking at outcomes as well? Prevention. Well, what will this mean for your working lives? Does this mean that you will have a different way in which you practice? Do you think you will be giving more information on how to be more healthy? There is a lot of talk about efficiency, and in situations, can you think of ways that the NHS needs to be more efficient? So at the end of the day, when you've put down, you don't need to answer all these questions, but some of them would if you can put down the thoughts on a few of these, and at the end of the day, I'll collect them and we'll summarise some of the responses and give some of my own opinions as well.